Welcome to Arthritis Now. I'm your host, Kyle Langen, and today we're going to be talking to Dr. Shiva Sharara for part 2 of her interview on rheumatoid arthritis. If you missed part 1, you can check it out right here. If not, sit back and relax as we dig a little deeper into her research on obesity and how it correlates to RA. And then we were also saying that you are doing a correlation between rheumatoid arthritis and obesity. It is a newer kind of thing that you're working on. Can you tell us about that?
What we found was that the mechanism by which obesity affects RA is basically is can be different in early onset and in resolution phase. So we found that there are specific cell types that contribute to early RA when the patients are obese compared to normal weight RA patients. So it's neutrophils, we believe, that are important in early onset of RA, and later in disease, we think it's myeloid cells producing specific factors that contribute to stopping the resolution. And basically, patients do not respond as well. Obese patients do not respond as well as the normal weight patients.
And what, in a perfect world, where would you like to see your research go in 5 years?
To come with novel therapies and biomarkers that we could predict response, so we could basically determine which patients treat with what therapies, and then to have newer drugs that would be more effective.
When would you like to start testing your science on people?
As I mentioned, we have the institute that I am in. We have very good access to human blood, and get tissues from our pathology core or our surgeons. And so we have those. We have cells from RA patients, we have tissues from RA patients, and so we initially determine our targets in RA patients, and so we have to go to animal models. And when animal models are successful, we come back again to our in vitro studies in RA patients. But it's not easy to get approval to do those treatments in patients, and then you have to establish these drugs before doing any testing. But we are always careful, and we always want to make sure that that we don't that we do all the preclinical studies prior to going with the phase 2 trial or anything like that. I think that the involvement of the donor to RA research is really important, and to have this knowledge and to contribute to RA research, it's really important that the donors are involved and understand the concept, and it's very important for us, the investigators, to have their support. And as you mentioned, the ANRF was tremendously important in the initiation of my career, and every dollar that is contributed to RA research goes far, because without these foundations, without the grant funding, the research would not be possible.
How do you feel about the current field of RA and maybe what's on the horizon that patients can look forward to in the future?
What I generally see is going to happen is, instead of randomly treating rheumatoid arthritis patients and going through the ABC steps, which are basically dictated by the insurance companies, we're gonna when you are diagnosed, or if anybody is diagnosed with RA, we're gonna get your blood, and we're gonna determine how the pathogenesis of your specific disease is, and we're going to treat you specifically rather than randomly giving you treatments that that you may not respond to. So it's going to be a more efficient treatment based on your disease, the patient's disease, rather than a very random way of treating the patient.
Thank you so much for your time and explaining all of your science and all your work that you're doing. We're so excited to hear what's on, what you come up with next. So we really appreciate it.
Thank you for having me.
Thanks for watching part 2 of our interview with Dr. Shiva Sharara. Make sure to subscribe to our YouTube channel and check out all the newest arthritis research on curearthritis.org. And don't forget to share this video on Facebook and Twitter to help raise rheumatoid arthritis awareness.